Thank you for participating in this important clinical research study. Your willingness to participate may benefit many people. This is an instructional video. It will show you how to easily collect your stool sample for an investigational colorectal screening test. Sit back, do nothing. At this point, you won't even need to open the box. Simply watch this entire video so you understand the procedure completely. There is a telephone number at the bottom of the screen. Call it any time, day or night, with questions about the procedure. Do not phone the doctor's office or clinic. Phone the call center, and if no one answers, leave a message. They will call you back. Remember, just watch now. The first thing you'll need to do is open the box. You will notice instructions for use and a sign alerting you not to remove the plastic bag or cardboard tray. Do not remove the plastic liner bag or cardboard insert tray from the box. These two pieces remain as part of the box, which is shipped back with your stool samples. No extra boxes are needed except what you have right in front of you. A couple of things to be aware of before you start collecting your stool sample. If you are having bleeding hemorrhoids, menstrual bleeding, or any known stomach or colon or intestinal infection, don't collect your stool sample until these conditions are resolved. Collect your stool sample anytime, Sunday through Thursday. Phone the call center as soon as you are done with your collection. First, let's open the box and find out what's inside. Here's what you have. Your box, which contains everything you need for collecting your stool samples and is also used to return the samples. Your alert sign, written instructions, a toilet seat bracket, a stool collection container, a green cap sample bottle, a white cap sample bottle, a bottle of clear liquid which contains a preservative for the stool. If any part of the box appears damaged or is missing any of the components just mentioned, call the telephone number at the bottom of the screen. So what are we going to do with all of this? First, let's just do an overall review. Here's the rundown. First, you provide a bowel movement. If you have diarrhea or liquid stools, please wait to produce a formed stool sample. You will be taking 2 small samples of your stool using the green cap sample bottle and then the white cap sample bottle. After you have taken the 2 samples, you will pour the clear preservative liquid over the remaining stool in the stool collection container. Then return the green cap bottle and then the white cap bottle to the box. Immediately after collecting your stool sample, phone the call center at the toll-free number 866-818-3254. They will arrange for a FedEx driver to pick up your stool sample. Be prepared, as they will also ask you questions regarding your experience with this collection device. Once you have phoned the call center and arranged for FedEx pickup, place the box that contains all of your samples in the location confirmed with the call center. Remember, if you have any questions or just want to confirm what you're supposed to do, call the number listed below. Okay, let's get started. First, unzip the plastic bag, then take the stool collection container, remove the lid, and set it aside. Lift the toilet seat. Place the bracket over your toilet and place the container in the hole in the bracket. Lower the toilet seat. When you are ready, allow your bowel movement to fall into the container. We don't need a really large bowel movement. This sample only requires a stool about the size of a regular candy bar or a small banana. Do not urinate in the collection container, as it will make the sample unusable. If you should accidentally urinate in the stool collection container, stop the collection process and phone the call center at the number listed below right away. With the stool in the container without urine, place it on a level, flat, dry surface like the bathroom floor or counter. Now remove the toilet bracket under your toilet seat and throw it away. Don't put the lid on the container yet. We have 3 simple tasks you need to complete with your stool sample prior to putting the lid on. Take the green cap sample bottle and open it by pulling the green cap left and upwards. Try to keep the sample bottle upright, as there is liquid at the bottom of it. Remove the cap, which has an attached probe stick. Scrape the surface of your stool sample with the stick. Cover the entire grooved area of the probe stick with stool. Now place the probe stick back in the bottle and securely seal it shut. Listen for a snap sound, and then you'll know the cap has been securely placed. Don't open it again. Now let's do the same thing with the white cap sample bottle. Open the bottle by pulling left and upward. Remove the cap, which has an attached probe stick. Scrape the surface of the stool sample with the stick. Cover the grooved parts of the probe stick completely with the stool. Now put the probe stick back in the bottle, twist to the right, and securely seal it shut. Don't open it again. Now one more step. Take the bottle of liquid preservative, pull the tape off, unscrew the lid, and pour the liquid over your stool sample in the collection container. Throw the empty liquid preservative bottle away. Next, take the lid and screw very tightly. You should be able to feel and hear the lid connecting and clicking to the grooves on the container. This will prevent the stool from leaking during shipment. Now you have to follow a few simple steps to prepare the sample for correct delivery. Just place the green cap bottle back in the slot in the box where it was removed. Then place the white cap bottle back in the slot in the box where it was removed. Place the tightly sealed stool container back in the insert area in the box. Now seal all of it in the plastic bag by zipping it closed. Now fold over the small box flaps first. You'll notice adhesive strips on each of the large box flaps. Next, remove the paper backing from the flap with the black plastic handle and fold shut. Once again, remove the paper backing, fold the last flap, and that will seal the box. Now phone the call center at the number shown at the bottom of the screen. If a live operator does not answer, leave a message and someone will return your call. The phone assistant will ask for the initials of your name and your subject ID number. Be prepared. They will ask you some questions related to your experience in collecting your stool specimen. They will confirm with you the best place to put the box for FedEx pickup. Take the box and put it in the agreed upon location. FedEx will come and get it. And you're done. Now, if you have any questions, just watch this video again or call the phone number on the screen. We thank you again for taking part in this very important deep sea study.